Come to this session. In this session, this is actually a second part of class, which is nerve muscle physiology. Already we have seen in the nerve muscle physiology about neurons, its structure, and the neuroglial cells and their functions. Today we're going to study the nerve and their classification and the functions of different types of nerve fibers. So this is basically classification of nerve fibers, which can be asked as a 5-mark question. Many MCQs can be asked from this topic. So what is a nerve? Nerve is nothing but the collection of nerve fibers, collection of axons which are located outside the central nervous system. And what is the term which is called as tracts? So we have known some of the tracts like pyramidal tract, corticospinal tract, extrapyramidal tract. There are many tracts, and the tract name explains that it is the collection of or bundles of axons which are present within the central nervous system. So there are two terms which we must remember. Already I told you the two important terms, which is nucleus and ganglion. I told you nucleus is nothing but the collection of cell bodies within the central nervous system, and ganglion is collection of cell bodies outside the central nervous system. And here we should know the collection of axons together forms nerve outside the central nervous system. The collection of axons outside the central nervous system is termed as nerve, whereas the collection of axons within the central nervous system, it is called as tracts. And these nerves are arranged as fasciculi. So here you can see a structure which is showing the nerve and the nerve fiber and fasciculi. So here you can see there is single nerve fiber. So here you can see there are multiple nerve fibers, and the collection of nerve fiber forms fasciculi, and there are many fasciculi which forms the nerve. So there is a single nerve fiber, so which is covered by a connective tissue which is called as endoneurium. So the single nerve fiber is covered by a connective tissue which is called as endoneurium, and there are many nerve fibers which is collectively termed as fasciculi. So each fasciculi again is covered by connective tissue which is called as perineurium, and all the fasciculi together forms nerve, and this nerve is again covered by a connective tissue which is called as epineurium. So nerve fiber, single nerve fiber, it is covered by a connective tissue which is called as endoneurium, which means innermost. So endoneurium, which is the connective tissue which is covering the nerve fiber, and collection of nerve fiber forms fasciculi, and these fasciculi, each fasciculi is covered by a connective tissue which is called as perineurium, and the collection of fasciculi together forms nerve, and this nerve is covered by a connective tissue which is called as epineurium. So this is the structure of the peripheral nerve. So how these nerve fibers are classified? Nerve fibers are classified into 6 types depending upon the structure. Depending upon the structure, these nerve fibers are classified as myelinated and unmyelinated fibers. So this already we have seen when we study about the axon. I showed you there is, in some neurons, the axon is lined by myelin sheath, and those nerve fibers are called as myelinated nerve fibers. What is the advantage of myelinated nerve fibers? In myelinated nerve fibers, the conduction will be faster because the nerve impulses will jump from one node of Ranvier to the next node of Ranvier. So that type of conduction is called as saltatory conduction. So that is the conduction which occurs in the myelinated nerve fibers. And the nerve fibers, the axon which is not lined by myelin sheath is called as unmyelinated nerve fibers. So this is the classification which is based on the structure. So depending upon the structure, nerve fibers are classified into myelinated nerve fibers and unmyelinated nerve fibers. Depending upon the distribution, these nerve fibers are called as somatic nerve fibers and autonomic nerve fibers. So what is meant by somatic nerve fibers? These nerve fibers will supply to the skeletal muscle. So any nerve fiber which is going to supply skeletal muscle, those nerve fibers are called as somatic nerve fibers. And if the nerve fiber is going to supply to the internal organs, those nerve fibers are called as autonomic nerve fibers. So based on the distribution, they are classified as somatic nerve fibers and autonomic nerve fibers. Depending upon the origin, they are classified as cranial nerve fibers and peripheral nerve fibers. So the spinal nerve fibers. So the depending upon the origin, it is classified as cranial nerve fibers, which means these nerve fibers arises from the central nervous system, whereas the spinal nerve fibers, they arises from the spinal cord. So if the nerve fibers arises from the brain, they are classified as cranial nerve fibers. If the nerve fibers arises from the spinal cord, they are classified as spinal nerve fibers. Depending upon the function, these nerve fibers are classified as, already I told you, sensory neuron and motor neuron. So here also it is based on the function. Sensory nerve fibers, which is also called as afferent nerve fibers, which carries the sensation from the periphery to the central nervous system. Whereas motor nerve fibers, which is also called as efferent nerve fibers, which carries motor information from the center to the periphery, which may be the periphery or effector organ, which may be the skin or the muscle or the gland. So depending upon the function, they are classified as sensory nerve fibers, which is also called as afferent nerve fibers, or motor nerve fibers, which is also called as efferent nerve fibers. Depending upon the secretion of neurotransmitter, these nerve fibers are classified as adrenergic nerve fibers and cholinergic nerve fibers, where some nerve fibers will release, the nerve terminals will release adrenaline. So the neurotransmitter which is released from some nerve fibers will be adrenaline. Those nerve fibers are called as adrenergic nerve fibers. And in some nerve fibers, the neurotransmitter is released as acetylcholine. So those nerve fibers are called as cholinergic nerve fibers. So adrenergic nerve fibers, where the neurotransmitter released is adrenaline. Cholinergic nerve fibers, where the neurotransmitter released by that type of nerve fibers is acetylcholine. So depending upon the diameter and conduction of impulse, nerve fibers are classified as type A, type B, type C. So there are three types of nerve fibers which are classified based on the diameter and conduction of impulse, and this classification is called as Erlanger and Gasser classification. We will study detailedly about this type of classification, which is very important. And here we have seen, we can see a picture which is showing this is a myelinated type of nerve fibers and this is a unmyelinated nerve fibers. So the axolemma is the axonal membrane, and node of ranivers are there in between the where the myelin sheath is absent. This is the places where myelin sheath is absent. Axoplasm is the cytoplasm of the axon. You know that Schwann cells are the type of macroglial cell which helps in the formation of myelin sheath in the peripheral nervous system. So oligodendrocytes are the other type of macroglial cells which forms the myelin sheath in the central nervous system. So here we come to the Erlanger and Gasser classification. I told you the nerve fibers are classified based on the diameter and conduction velocity. So it is classified as type A, type B and type C fibers. So again it is subdivided into, type A nerve fibers are subdivided into A alpha, A beta, A gamma and A delta. So these are the type A fibers. So this Erlanger and Gasser classification, it is for both sensory and motor fibers. There is one more classification which is called as Lloyd and Hunt classification, which is also called as numerical classification, and that is only for sensory nerve fibers. So here it is for both sensory and motor fibers. So Erlanger and Gasser classification is both for sensory and motor nerve fibers. So based on the this classification, there are three different types of fibers: type A, type B and type C. And this type A and type B both are myelinated nerve fibers, whereas type C is the unmyelinated nerve fiber. Type A and type B are myelinated nerve fibers. Type C is the unmyelinated nerve fiber. So type A is subdivided into A alpha, A beta, A gamma and A delta fibers. So as you can see in the table, it is shown as the diameter of the nerve fiber. So when you see A alpha, the diameter is 12 to 20 micrometers. Diameter is 12 to 20 micrometers, whereas in A beta it is 5 to 12 micrometers. A beta it is 5 to 12 micrometers. A gamma it is 3 to 6 micrometers. A delta it is 2 to 5 micrometers. So you can see the diameter is decreasing. So here you can see the conduction velocity 70 to 120 meter per second in A alpha nerve fiber. In A beta nerve fibers, the conduction velocity is 30 to 70 meter per second. In A gamma fibers, it is 15 to 30 meter per second. And in A delta fibers, it is 12 to 13 meter per second. So what is the thing which you must remember is, so greater the diameter, greater the conduction velocity. As you can see here, the conduction velocity decreases as the diameter decreases. So if you see in the type B fibers, the fiber diameter is less than 3. In type C fibers, it is from 0.4 to 1.3. So 0.4 to 1.2 is the type C. 0.4 to 1.3 is the type C, the diameter of the type C fibers. So the conduction velocity is also from 0.5 to 2.3 meter per second. So as you can see, greater the diameter. So you can see the A alpha fibers have greater diameter, so the conduction velocity is greater, whereas type C fibers, they have the lesser the diameter, and conduction velocity is also less. So greater the diameter, greater the conduction velocity. You can remember by 2 MCQs, which nerve fiber has the fastest conduction velocity. So what is the answer? A alpha is the nerve fiber which has the fastest conduction velocity because the diameter is greater. Which is the one which is having slowest conduction velocity? So it is type C fibers because the diameter is very less and the conduction velocity is also less. So this is very important. At least these 2 MCQs you must remember. And A alpha, what is the function of these fibers? So A alpha is having both sensory and motor function. The sensory function is proprioception, and the motor, it is A alpha. You must have heard alpha motor neurons. So these are the motor neurons which is going to supply to the skeletal muscle fibers, especially to the extrafusal fibers, extrafusal muscle fibers. You're going to study about muscle spindle. You will know what is extrafusal and what is intrafusal fibers. So just remember, the extrafusal muscle fibers are supplied by A alpha motor neurons. So this is A alpha. The function is, sensory function is proprioception, and the motor function is, it is supplying to the motor to the skeletal muscle fibers. A beta, it is purely sensory, which is going to carry touch and pressure sensation. A gamma, so it is purely motor. You must have heard gamma motor neurons, which means they are motor to the muscle spindle, and this is going to supply to the intrafusal fibers of the muscle spindle. And A delta, it is also purely sensory, which is going to carry pain and temperature as well as pressure. So the pain, A delta fibers, which is going to carry pain, which is a sharp pain, and it is a pricking type of pain. So it is a sharp pain, it is a fast pain, it is a pricking type of pain. Whereas type B fibers, these are preganglionic autonomic fibers. So it is preganglionic autonomic fibers for both sympathetic as well as parasympathetic nerve fibers. Type C fibers, it is the dorsal root fibers are carrying pain and temperature, whereas the sympathetic nerve fibers is carrying postganglionic sympathetic fibers. So the type C fibers, the function is pain and temperature, as well as they are postganglionic sympathetic fibers. So you can see only these two, that is the A gamma and type B fibers, both are purely motor. So when we say Lloyd and Hunt classification, these two will not be there. So A alpha will be type 1, A beta will be type 2, and A delta will be type 3, and C fiber will be type 4. So this is another classification only for sensory fibers. So Lloyd and Hunt classification or numerical classification is only for sensory fibers. Here the Erlanger and Gasser classification is for both sensory and motor fibers. Just remember this. So what are all the points you must remember? A alpha, it is combined both motor and sensory. So the motor is, it is the alpha motor neurons to the muscle fibers, that is extrafusal fibers of the muscle spindle, it is going to supply, and the sensory function is proprioception. A beta is touch and pressure, which is purely sensory. So this is type 2 in numerical classification. A gamma, it is purely motor, which is going to supply to the motor to the, which means the intrafusal fibers of the muscle spindle. And A delta, it is again purely sensory, which is pain and temperature. A delta is going to carry sharp pain or a fast pain. B is the purely sensory, again it is purely motor, it is again preganglionic autonomic nerve fibers for both autonomic and for both sympathetic and parasympathetic fibers. Type C fibers, again it is pain, it is going to carry pain and temperature sensation. So A delta and type C fibers both are going to carry pain. So what is the difference? A delta fiber is going to carry fast pain or a sharp pain or a pricking pain. Type C fiber is going to supply to the, which is going to carry slow pain, or it is a dull pain, slow pain or dull pain, which is going to actually it will be a aching pain. So it is a dull aching pain. So this type of pain is called dull aching pain, which is carried by type C fibers. So this is Erlanger and Glasser classification. We will see the briefing here. So A alpha, I told you according to Erlanger and Glasser classification, type A, type B and type C fiber will be there. Type A is again subdivided into A alpha, A beta, A gamma and A delta fibers. A alpha, it is the largest diameter. 12 to 20 is the micrometer is the diameter of these A alpha fibers, and it is the maximum myelinated nerve fiber. So it is, I told you, A and B fibers are myelinated nerve fibers. Type C is the unmyelinated fiber. So because it is having largest diameter, the conduction velocity is 70 to 120 meter per second. So it is the fastest conduction velocity nerve fiber. The function is proprioception, which means, what is meant by proprioception? It is the joint position sense, and it is A alpha motor neuron to muscle spindle. A beta fibers, they are purely sensory, which will carry the touch and pressure sensation. And A gamma fibers, they are purely motor and gamma motor neurons to the muscle spindle, especially to the intrafusal fibers. They regulate the muscle tone, and they are also important for certain reflexes. A delta fibers, they carry the fast pain, sharp pain or epicritic pain, and they also carry temperature. So A delta fibers, the function is pain and temperature. B fibers, these are also myelinated fibers, which is the function is pre-ganglionic autonomic nerve fibers. Type C fibers is, they are going to carry pain and temperature, and they are post-ganglionic autonomic nerve fibers. And here you can see the type C fibers will carry slow pain or a long-lasting pain, burning pain, visceral pain, and they are also carry temperature sensation. So these are unmyelinated nerve fibers. So this is about type A fibers and the Erlanger and Gasser classification. So here you can see only the Lloyd-Hunt classification, which is also called as numerical classification. So according here, 1A, which is the A alpha fiber, sorry, I told you 1 is, which is A alpha, right? It is again subdivided to 1A and 1B. 1A is the origin is muscle spindle and annulospiral endings. 1B is Golgi tendon organ. So A alpha is 1, 1A is muscle spindle and annulospiral ending. 1B is arising from the Golgi tendon organ. Type 2 fiber, it is A beta fibers. What is the function of A alpha? A alpha is proprioception, and motor function is, so a sensation, based on the sensation it is going to supply the proprioception. So I told you this classification is only for sensory fibers. So type 2 fiber is A beta fibers. It is going to supply to the muscle spindle, which is flower spray ending and touch and pressure. So this is 1A is annulospiral ending, which is muscle spindle. It arises from the annulospiral ending of the muscle spindle. 2 is muscle spindle, which arises from the flower spray ending. And this also, the function is touch and pressure, the other function. And type 3 fiber is A delta, which is pain and temperature and touch, and this is mainly cold temperature, so cold receptors. And type 4 is pain and temperature and other receptors, and this is dorsal root C fibers. So 1 is A alpha, 2 is A beta, 3 is A delta, and 4 is dorsal root C. So what is left? A gamma and type B fibers are left, which is coming under the motor classification. So motor fibers, both are motor fibers. So these two are only pure, this is Lloyd-Hunt classification is only for sensory fibers. So here we have another table which is showing the susceptibility of nerve fibers to conduction block, which is produced by different agents. So here you can see hypoxia, pressure and local anesthetics, and these are the different agents which can cause the conduction block in different nerve fibers. So here you can see the fibers which is most susceptible to hypoxia, which is B, and the fiber which is most susceptible to pressure is type A, and the pressure fiber which is most susceptible to local anesthetics is C. So this is intermediate susceptibility, and this is the classification which is showing least susceptibility. So type C fibers are least susceptible to hypoxia and pressure. Type A fiber is least susceptible to local anesthetics. And many MCQs can be asked from this table. So which is the most susceptible fiber to hypoxia, which is B. Which is the most susceptible fiber to pressure, which is A. So we can remember this type A fiber, which is we have heard some term which is called a Saturday night palsy. When the forearm is kept under the head, and if they slept, and what will happen? There will be some palsy will occur. So that is called a Saturday night palsy or Sunday morning palsy, and in that palsy mainly type A fiber will be affected because it is mainly due to the pressure. So this palsy is mainly due to the pressure which is applied in the forearm to the nerve. So this is type A fiber, which is most susceptible to pressure, and local anesthetics. So if we inject some anesthetics, type C fibers, which means type C fibers, type C fibers carry pain, which is especially slow pain. So these local anesthetics, mainly it is more susceptible to type C fibers, and type A fibers are the least susceptible to local anesthetics. So here we have a table which is concluding all both of these Erlanger and Gasser classification and the Lloyd and classification and the functions. So A alpha, according to Erlanger classification, A, B and C. So A alpha, A beta, A gamma and A delta. So A alpha is in Lloyd and classification, it is 1. So again it is subdivided into 1A and 1B. Just remember, 1A is the annulospiral ending, 1B is the Golgi tenon organ. So A beta, it is again muscle spindle, which is flower spray ending, so which is type 2. A delta is type 3 fibers, which is carrying fast pain, and C is the slow pain, which is classified as type 4 fibers. So this is Gerlanger classification, this is Lloyd or numerical classification. I told you A and B both are myelinated nerve fibers, whereas only C is the unmyelinated nerve fibers. So the diameter, as you can see, A alpha is the largest diameter fiber, whereas type C is the smallest diameter nerve fiber. The conduction velocity in A alpha, it is the fastest conduction velocity. Type C is the slowest conduction velocity nerve fiber. And the function is A alpha, it is both sensory and motor. So the sensory function is, it is proprioception, which means the joint position sense, and it is going to supply motor supply to the muscle spine. So alpha motor neuron to the muscles. A beta, it is touch and pressure, and A gamma, it is the gamma motor neuron to the muscle fibers. It is intrafusal muscle fibers. A delta, it is pain and temperature, pressure and touch. So pain, it is the fast pain. Type B is, it is preganglionic autonomic nerve fibers. Type C, again it is pain and temperature, and postganglionic autonomic nerve fibers, it is going to carry the slow pain. So what are the most susceptible to this different nerve fibers? So type A fiber is most susceptible to pressure. Type B is more susceptible to hypoxia. Type C is more susceptible to local anesthetics, and type A fiber is the least susceptible to hypoxia and pressure. So here we have some of the MCQs. Nerve conduction is slowest in which fiber have slowest conduction velocity? Yes, it is C fiber. You know, A fiber, A alpha is the fastest conduction velocity. C fiber is the slowest conduction velocity. So the answer is A. That is, slowest conduction velocity is type C fibers. Slowest conducting fiber, this is the another way, which is the same explanation. So you know, type C fibers are also called as postganglionic autonomic nerve fibers. So type B is preganglionic autonomic nerve fibers, and the function of type C fiber is they are postganglionic autonomic nerve fibers. So it is the another way to classify. Slowest conducting nerve fiber is postganglionic autonomic nerve fibers. Preganglionic autonomic nerve fiber is given the other name type B fibers, right? Proprioceptive is A alpha. Sharp pain is transmitted by, so you know, pain is transmitted by A gamma and C fibers. So sorry, A delta, gamma motor fiber, sorry, A delta and C fibers. So A delta is the answer here. Sharp pain, which is the first pain, right? So it is carried by A delta fibers. A delta fibers carries a sharp pain, whereas type C fibers will carry slow pain. Person wakes up with pain, paresthesia, tingling of the arms. He had slept with arm below the head. Which fibers are involved? So this is the example of the Saturday night palsy, right? So this is the question which explains that which is the nerve fiber which is most susceptible to pressure, right? So type B fiber is type A fiber is most susceptible to pressure. So type B fiber is most susceptible to hypoxia. Type A fiber is most susceptible to pressure. Type C fiber is most susceptible to local anesthetics. So you must remember BAC. So hypoxia is B. Type A is pressure. Type C is local anesthetics. Which of the following nerve fiber is most susceptible to hypoxia? So We said it is type B. Type B nerve fiber is the most susceptible fiber to hypoxia. So here you can ask many MCQs from this one table, one question which you can change it as, which is the most nerve fiber which is most susceptible to pressure, which is A. Which is the nerve fiber which is most susceptible to local anesthetics, which is C. So that you must remember. Thank you.